A public hospital in Santiago. The waiting room at emergency is jammed.
Juan Payacar fue salida.
There are 42 people in line to receive chemotherapy. And possibly the busiest place in the building is here, the Office of Complaints. But in Chile, they're not just talking about improving health care, they're acting on it. With universal coverage, no one goes uninsured here. But as in many developing countries, wait times for certain procedures can be long, and huge gaps in access and health outcomes were detected between haves and have-nots. So the government launched health care reform, but unlike the U.S., where the conversation has focused on coverage and costs, Chile chose to tackle certain conditions which, by the numbers, affected the most people everywhere. They literally came up with a list.
It's a list. You can go to the website of the Ministry of Health. You can go to the guarantee system, and then you will have the list.
Dr. Hernan Sandoval headed the committee that created the health reform effort, known here as Plan Auge. The list contains conditions which the government has pledged to treat with timely, quality medical care, no matter who you are. Your coverage for these conditions is guaranteed as a matter of law. The list is determined by how dangerous the condition is to the population and the feasibility of cure if it's tackled quickly.
We didn't put the money first, and then we decide what to do. It was clearly the opposite. We decide what to do and how to put the money in the thing we wanted to do. We have still gaps between social class and income and education groups, but we are trying to reduce it.
Plan Auge includes such things as diabetes, heart attacks, depression, and palliative care at the end of life. Studies have found more than 3 million Chileans, mostly from its public insurance system, have used Plan Auge. Still, the cost-benefit approach does lead to some interesting choices. Prostate, breast, and cervical cancer are on the list. Pancreatic cancer is not.
Because the rate of success is very low in some cancers, and in other cancers you can have.
So if you develop pancreatic cancer, you can still get treatment, but not on the fast track as a Plan Auge patient.
What's the youngest baby you have here? How old?
24 weeks.
Chilean neonatologist Waldo Osorio Catalan says overall, the plan has increased the quality of medical care.
Do you regard Plan Auge as an improvement?
Yes,
Can you describe why?
because the patient some years ago had to wait for some treatment. Now you have some protocol.
But here in the hospital neonatal unit, we met Patricia Fuentes Concha, whose son Belen was born with a host of problems.
He has problems feeding. He doesn't increase his weight, he throws up.
How old is he now?
3 months.
She tells us that her first child, born 15 years earlier, had this same condition and lived only a year and a half. As the infant's plight is rare, this is not an Auge case. So when he leaves the hospital, she'll be in the regular public system. No fast-track guaranteed care for this little boy.
Tengo miedo.
She's scared. Scared of what? O sea, miedo de qué?
That the same thing will happen as happened with my first.
A seller at a street fair tells us she had appendicitis and was treated as a Plan Auge patient. She still feels she waited too long, but she was incredulous that the U.S. doesn't have guarantees of good medical treatment for every citizen written into its laws.
You would think a country so much bigger than Chile, so much more developed and advanced, you would think you could give people that right.
The trick is really to find out how you spend on the things that are worth spending on.
Newsweek columnist Robert Samuelson is watching the health care reform debate unfold in the U.S. as Americans struggle with the competing priorities of covering the uninsured, keeping their physicians, and controlling costs.
We have not been willing to face these choices, and as a result, costs are out of control, and to some extent we limit care for people. We kind of juggle these balls, but we've got a system that is basically not working.
Chile's health reform did generate rebellion from some doctors. Plan Auge patients must receive very specific protocols or treatment regimens that are established by the state in accordance with medical experts. So are you restricting in some way doctors' abilities to decide the best course of treatment for their patients?
Sure, we are. It's good.
It's good.
It's good.
And why is it good?
Because the results are good.
He says health reform in the U.S. must inevitably turn its attention from focusing on costs to focusing on goals.
The health reform concerned the health insurance, but do not concern the health results, the health outcomes. Until the moment you will see which kind of health we have and what do we want to obtain. And then they put the money and the institutions and insurance behind the objective you have. Otherwise, you will discuss money, and money is another discussion.
For World Focus, this is Edie Magnus in Santiago, Chile.